Hi, everyone. It's Dr. Stevens. How are you today? We're going to talk today about boosters. And so as we see in this chart, vaccine efficacy has decreased through time. So if you look over here, by June or July, we're seeing a little bit more breakthrough cases with the COVID-19 vaccines. Now, to keep in mind, that's for mild to moderate disease, but in terms of hospitalizations, the vaccine's holding up. It's preventing deaths and it's preventing hospitalizations, which is the real intention of this vaccine. However, if you are in a high-risk group, or if you're being exposed to lots of people who have COVID-19 through your work, then you may want to consider getting a booster. And so Chapa-De is offering booster vaccines for those who are 18 and up. And for the Johnson & Johnson vaccine, it will be 2 months after you've gotten your first dose. And for the Moderna and Pfizer, it will be 6 months after you've gotten your second dose. Remember, boosters are not mandatory to be considered fully vaccinated for a lot of the vaccine mandates. And so it is a personal choice, and the decision is often made if you want additional protection from COVID-19. So the California Department of Public Health is recommending that if you are above the age of 65, or you live in a long-term care facility, or you have some of the high-risk medical conditions, or social inequities, or occupational or work exposures, that you consider getting a booster vaccine. The question often is, well, then which vaccine do I get? All three have been approved as a booster vaccine, regardless of which vaccine you got for your primary series. So for example, for those who've gotten Johnson & Johnson, if they get a booster shot with Moderna, they have a way more robust immune response. So they did a robust NIH study. And when you look over here in the group 1, you see that they have a 75% increase in antibody response with the Moderna vaccine for Johnson & Johnson compared to those who get a Johnson & Johnson booster, which is only 4 times more than more antibody response. So it really does show that sometimes mixing and matching, especially in the case of Johnson & Johnson, makes sense. And then for the other vaccines, you can get another Moderna after the Moderna series, or Pfizer after a Pfizer series, or if you prefer, a Johnson & Johnson after that as well. It still provides you a little bit of an extra protection there. So vaccine side effects is the other side of this, right? So looking at this chart, we can see which vaccines have a little bit more side effects than others, and that may play a role in the decision of which one to get. Now, these side effects, keep in mind, are self-resolving and within 48 hours, and it's just really your immune response to the vaccine, so showing that that vaccine is working. The other thing to keep in mind is that, you may think about age and gender, sex, which may influence your decision of which booster to get. So when we look at the rare cases of blood clots with Johnson & Johnson vaccines, those 11 cases per million that we see are happening in women 30 to 39 years of age. So if you're in that age group and you don't want to risk that rare side effect, you may consider getting an mRNA vaccine like Moderna or Pfizer. Now, if you're a younger man who's under the age of 30, there is a 4 out of a million chance of getting myocarditis, or this inflammation of the heart muscle. And if you're in that category and that's concerning to you, you may consider getting a Johnson & Johnson booster. So that can also play a role in that. The other question I get a lot is, well, do I need to get a booster at all if I have antibodies against COVID-19? And can I just get an antibody test? And so, unfortunately, the CDC and the FDA don't recommend this. And that's because the antibody tests that we have that we can order are binary, meaning they give you a yes and no answer. They don't tell you how much. So if you've had COVID-19 in the past, it's a good test to kind of answer that question, because it will tell you, yes, it's positive for antibodies, or no, it's negative for antibodies. But if you really want to know, do I have enough or the right type of antibodies to really attack a virus when I see it in the future? this test won't actually answer that question for you. So it's not a great test to answer, do I need a booster? Because that science is still evolving and scientists don't actually even know how many antibodies are actually needed to protect you. Like we do know with other disease processes like hepatitis B, in which we use those antibody titers pretty frequently. If you have any questions, please reach out to your healthcare provider and we're here for you. Thank you.